Major surgeries cause a 2-month POTS flare for me. This might have to be our last question, but it's a good one. This was Jerry. I'm so sorry, Jerry. I've had 3 big flares post-surgery. The first week's bedridden, even hospitalized. Is it the anesthesia? Anesthesia can activate certain forms of inflammation. We see that all the time. And pre-medicating with things like antihistamines, Paracin Plus, NAC-Max, be ready for intracranial pressure to go up just in case. And then some patients need a little help with more steroid. That can help. But that is a very common trigger for some types of inflammation, anesthesia, and the trauma from surgery. So trauma, be it like a TBI, a car accident or something, and even emotional trauma can be sufficient to trigger an inflammatory response that ultimately ends up with POTS. And then anesthesia is one that can also do that. So that's kind of a vicious combination. Something I noticed with my mom, she had some symptoms. She wasn't POTS, at least, I don't know, maybe she wasn't. I didn't know about POTS back then. But she was hypermobile and she would flush and she was prone to having reactions that looked suspicious for anaphylaxis type reactions. And she did have many surgeries, like 25. And after every surgery, she was worse. And I remember thinking toward the end, why is no one looking at what are these surgeries doing to her? Like when they removed ultimately her gallbladder, they said it was fibrotic. It was brown, shriveled up, scarred. I thought, are we activating some sort of inflammatory process that is then damaging us further than resulting in another surgery, which continues to damage us? Perhaps. So do pre-medicate as much as you can, and sometimes less is more. I think one reason I ended up on the other side of this illness, and my kids did too, was we got lucky. Fear drove a lot of decisions there for a while. I didn't want anything invasive because my son was so sick and he was so young. And when they talked about surgeries for me, which I said, I don't care what you have to do, cut my head off. I am so sick, whatever you have to do. And then they'd look at him and they said, let's do him too. That I would pause, say, we're missing something. So I was kind of set up perfectly to resist getting some of those surgeries and instead try to figure out medically what is going on, and ended up on the other side. And you can't do